Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Anggarani Rahma Ramadhani from group EMP 8. And now I will present about Consort 2010 checklist of information to include when reporting a randomized trial. So let's jump to the first item. The first item is item number 1A, identification as a randomized trial in title. In this article is reported on page number 1. We can see it from the title. A comparison of the effectiveness of azelaic and pyruvic acid pills in the treatment of female adult acne, a randomized controlled trial. The next item is number 1B, structured summary of trial design, methods, result, and conclusions. In this article is reported on page number 1, but the abstract of this article is unstructured. We can see it on the red box. Chemical peels are widely used as therapeutic agents in dermatology and cosmetology until the last sentence. The study was registered in the ISR-CDN registry. That's all for the first section, which is title and abstract. Next, we move on to the introduction. Item number 2A, scientific background and explanation of rationale is reported on page number 1 and 2. From the introduction is highlighted in pink. Firstly, talk about the characteristics of acne vulgaris. And then talk about the treatment of acne. And then talk about the clinical effect of azelaic and pyruvic acid pills on acne. Lastly, the present study. The next item, number 2B, specific objectives or hypothesis, is reported on page number 2. The specific objectives of the study compares AA and PA to examine their effectiveness in the treatment of acne vulgaris in young adult women. And the hypothesis in the study, they did not formulate any specific hypothesis, because to the best of their knowledge, they are exploring the efficacy of 2 acne treatments for the first time. We can also find what is known and what is unknown. We know that both AA and PA acids are well known in acne treatment, and what is unknown is the efficacy of these acids. That's all for the introduction section. Next section is methods. Item number 3A. Item number 3A, description of trial design such as parallel, factorial, including allocation ratio, is reported on page number 5. The study was designed as a prospective parallel randomized clinical trial. Next item, number 3B, is not reported in this article. And the next item, number 4A, eligibility criteria for participants, is reported on page number 5. Eligibility criteria were as follows: female gender, 18 until 25 years of age, no dermatological treatment within the last 12 months, and mild to moderate papulopustular acne. The exclusion criteria were as follows: pregnancy, lactation, active inflammation of the skin, and etc. The next item, number 4B, settings and locations where the data were collected, is reported also on page number 5. So the location is at the Opole Medical School in the south of Poland. The next item, number 5, the interventions for each group with sufficient details to allow replication, including how and when they were actually administered. And also the next item, number 6A, completely defined pre-specified primary and secondary outcome, including how and when they were assessed, is reported on page number 7 in the measures, which is highlighted in green. The next item, number 6B, any change to trial outcomes after the trial comments with reason, is not reported in this article. And the next item is number 7A. How sample size was determined? Is reported on page number 5. The sample size was determined using the coherent formula correction for the small population. Our initial estimate of sample size include an assumption of acne vulgaris occurrence among young adult women of 60%. We estimated that a total of 165 female students would be needed to detect a difference between groups supposing an alpha of 0.05, 95% confidence level, and 5% precision. Out of a total population of 300 undergraduates studying cosmetology at the university. And the next checklist, number 7B, when applicable, explanation of any interim, analyze, and stopping guideline is not reported in this article. Also, the 8A is not reported on this article. So let's jump to the next item, 8B, type of randomization details of any restriction, such as blocking and block size. So this is reported on page number 5. The block randomization was used here to divide undergraduates into one of two parallel groups, AA-BA, AA-BA, in a 1-to-1 ratio. The next checklist or the next item is number 9, mechanism used to implement the random allocation sequence, such as sequentially numbered containers describing any steps taken to conceal the sequence until intervention were assigned, is reported on page number 5. All participants present with acne vulgaris according to diagnosis using the scale of Hallegren-Vincent Severity Symptoms or SHVSS. The next checklist, number 10, who generated the allocation sequence, who enrolled participants, and who assigned participants to interventions, is reported also on page 5. Researcher Carolina Chilik performed a random allocation sequence, enrolled participants, and assigned participants to intervention. The next checklist, number 11A, if done, who was blind after assignment to intervention is not reported in this article. Also, the number 11B, item number 11B is not reported in this article. The next reported is number 12A, item number 12A. Statistical methods used to compare groups for primary and secondary outcomes. In this article is reported in page number 7 in statistical analysis, which is highlighted in purple. Okay, for the next item number 12B and 13A is not reported in this article. Well, let's just move to the next item that reported, number 13B. Number 13 is, the section is diagram. Number 13B, for each group, loss and exclusions after randomization together with reasons. So in this article is reported in page number 6 and page number 2. In this page number 6, there is a diagram. So firstly, there are 165 participants and the exclusion is 45%. So the cohort is 120 and they are divided into group 1 for azalite pill and group 2 for pyruvic pill. Each group contains 60 participants. And then when follow up, there is no discontinued treatment and all 60% of each group analyzed and none were excluded. We can also see it on the page 2. There were no cases of loss and exclusions after randomizations. That's for number 13B. Next checklist is number 14A, dates defining the periods of recruitment and follow-up, which reported on page number 7 and page number 5. In the page number 5, the study initially recruited between 27 and 31st January 2020. And on the page 7, this prospective parallel clinical study with follow-up analysis was conducted between January and April 2020. The next item is number 14B. Why the trial ended or was stopped is not reported. The next checklist is number 15. Number 15 is a table showing baseline demographic and clinical characteristic for each group. In this article, the author gives baseline clinical characteristic only. The demographic characteristic of the patients are not reported. The next item, number 16, is not reported in this article. And the item number 17A, for each primary and secondary outcome result for each group at the estimated effect size and its precision is reported on page number 2, which is highlighted in purple. The mean result, standard error, and 95% confidence interval are shown in table 2. And table 2 shows the result of the one-way ANOVA with repeated measures. The next item is number 17B. It's not reported in this article. Also, number 18 is not reported. Next item is that reported in this article is number 19. All important harms or unintended effects in each group. So this is reported on page number 7. And fortunately, no harm or unintended effects related to the treatment were reported by participants. The next checklist and the next item is number 20, trial limitation, addressing source of potential bias, imprecision, and if relevant, multiplicity of analysis. So this is reported on page 5. Limitations of the study and further direction of research. The results of the study are promising but require confirmation in further research. For the next item, number 21, generalizability, like external validity, applicability of the trial finding is not reported in this article. The next item that reported is number 22, interpretation consistent with result, balancing benefits and harms, and considering other relevant evidence, which is reported on page number 5. The effectiveness of azelaic and pyruvic acid in acne treatment is comparable, as confirmed in the study. Both acids produce similar decrease in acne severity and lesions and decrease desquamation. However, PA reduced greasy skin to a greater extent than AA. The selection of patient is mandatory when choosing between AA and PA pills. An acid treatment should be related to the skin structure, the expected effect on the oiliness of the skin, and the extent to which side effects occur. The sense of safety in women during hormonal therapy, pregnancy, and lactation should be prioritized. The next item, number 23, registration number and name of trial registry, is reported on the page number 7. The study was registered in the International Standard Randomized Controlled Trial Number, or ISRCDN, registry, and the registration number of the study is ISRCDN 797166614, and the date is 17th of January 2020. The next item, item number 24, where the full trial protocol can be accessed if available. So this is reported on page number 8. The study protocol is available in the ISRCDN registry at https://www.isrcdn.com/ the registration number of the study. Finally, we already on our last item, item number 25, source of funding and other supports, such as supply of drugs, role of funders. In this article, also reported on page 8, this work was the part of the research grant number ZP3/FI/2020, funded by Ministry of Science in Poland. So that's all for a Consort checklist of information to include when reporting a randomized trial for this article. That's all from me. Wassalamualaikum warahmatullahi wabarakatuh.